So I'd like to begin by acknowledging all the physicians and scholars who have sacrificed time and energy studying the issue of brain death. Their efforts have made today's presentation possible. I would like to especially thank Dr. Doyen Nguyen and Dr. Alan Schumann for their self-sacrifices in this area and their contribution to my understanding of brain death. So I am indebted to them. I thank Texas Right to Life for inviting me here to speak, and I thank each of you for taking time out of your busy schedules to attend this conference, because we're all busy. We all have things to do, and so this is a great sacrifice that you've made. Thank you. Above all, I would like to thank my wife and daughter, Jen and Tabitha. The time that I spend writing, speaking, and studying about brain death is time taken away from them. So their sacrifices made this possible. When I was leaving, my daughter said, "No, Daddy, please don't go." I said, "All right, well, I'm going to be going, but I'll bring you back something." And we spoke a little bit earlier at the prayer breakfast about what would happen if Roe v. Wade is overturned. And so let me just add my 2 cents. Adoption. Adoption is the answer. Adoption is the answer to overcome racism. Adoption is the answer to building bridges between people of different socioeconomic status. Adoption expands families. Adoption is a very good thing, and we emulate our Heavenly Father who adopted us. And for those who are adoptive fathers like myself, who happen to be named St. Joseph, we emulate St. Joseph. It's a tremendous privilege, adoption is. And so I love my family very much. And that's also something about which I'm passionate. But today, we're going to talk about brain death. In 1992, in Casey versus Planned Parenthood, 3 Supreme Court justices wrote, "At the heart of liberty is the right to define one's own concept of existence, of meaning, of the universe, and of the mystery of human life." Now, those of us who are active in the pro-life movement are familiar with that phrase and its implications for abortion. What you may not realize is that our country has also determined we can define our own concept of death. And that's what we're going to talk about this morning. I would like to begin with the story of Zach Dunlap. Now, Zach is from a small town outside of Oklahoma City. In 2007, at the age of 21, he was in an ATV accident and suffered a severe brain injury. He was airlifted to a hospital. In 36 hours was declared brain dead. Now, Zach had put on his driver's license that he wanted to be an organ donor, and his parents consented to have his organs harvested. But around this time, Zach's cousin, who was a nurse, became concerned that Zach wasn't dead. And so he took Zach's foot, and he took his closed pocket knife, and he scraped it along the bottom of Zach's foot. And Zach jerked his foot away. And then he took his fingernail, and he dug it under Zach's fingernail. And Zach jerked his hand away. And he said, "My cousin Zach's not dead." The imminent organ harvesting was called off. So Zach escaped death by organ harvesting by hours. Now, 5 days later, Zach opened his eyes. 12 days later, Zach took his first steps and said to his parents, "I love you." 48 days later, Zach walked home out of the rehab center, and he subsequently got married and had a daughter. 5 months later, Zach was being interviewed on Dateline and Today Show, and what he said was, "I could hear the doctor declare me brain dead, but I was powerless to do anything about it." Let's hear that in Zach's own words.
Next thing I remember was laying in the hospital bed, not being able to move, breathe, couldn't do anything, on a ventilator, and I heard someone say, "I'm sorry, he's brain dead, he's passing away." And there's nothing I could do. You could just get mad. I couldn't do anything to assign at all.
If you are an organ donor on your driver's license, this could happen to you, or your child, or your grandchild. It's important you know the risks of being an organ donor. We'll get back to Zach's story, but first let's talk about what is death and what is brain death. Okay? We'll begin with the human person. The human person is the substantial union of body and soul. We are a body-soul composite. We have a material component, the body, and an immaterial component, the soul. Now, the soul is the principle of integration of the body. It holds the body together and allows it to function as a coherent whole. What is death? Death is the moment that the soul leaves the body. Now, how can we know that the soul has left the body if the soul's invisible? We can't see it. The answer is by the consequences of the soul's absence. When the soul leaves the body begins to disintegrate, to come apart, because its principle of integration has left. And death manifests itself the same way in all warm-blooded mammals. So when I say my pet dog has died, it means the same thing as when I say my uncle has died. And we all know what a dead animal looks like. Now, in human beings, certain signs of death have been described. The body cools to become ambient temperature. It becomes stiff, which is called rigor mortis. The blood drains from the surface capillaries into the deep, dependent veins, leaving the non-dependent skin gray and lifeless, and the dependent skin purplish red, which is called livor mortis. Eventually, putrefaction sets in. So I'm going to show you a photograph of what death looks like. Now keep that in your mind, all right? That is what death looks like. Now look at your driver's license, because you may not remember. When you got your driver's license, you chose whether or not to become an organ donor. Now, if you chose to become an organ donor, your thought process probably went something like this. If I'm dead, I won't need my organs anymore. And it would be a good thing for me to give my organs to someone else. It would help them out. Well, the problem with this is that if you were actually dead, your organs wouldn't be good for someone else because they'd be decaying. And so what was needed was a new definition of death. And that is what came to be known as brain death. In 1968, the Harvard Medical School ad hoc committee defined irreversible coma as a new criterion for death. Irreversible coma as a new criterion for death. Now you can hear that's an oxymoron. For to be in a coma is not to be dead, but to be alive. But this deeply comatose state is what we now call brain death. Now, brain death claims a person is dead based on loss of brain function. A brain-dead patient is warm and pink, they have supple flesh, and they're capable of movement. Brain-dead pregnant women gestate their children. In other words, brain-dead patients look very much alive, and that's because they are alive. It is now widely accepted that brain-dead patients are biologically living organisms. And the question has really moved into the philosophical realm. Do they count as human persons? For those of us here today, I think we would all answer yes. Brain-dead patients are sick, and they are usually dying, but they are not dead. And we may not end their lives so as to take their organs. Now, how is someone diagnosed as brain dead? Well, remember, in 1968, the Harvard Medical School Ad Hoc Committee defined irreversible coma as a new criterion for death. There's two very important things to note about this. The first is that the first heart transplant occurred less than a year before this new definition of death. So there is a very close temporal relationship between brain death and organ transplantation. If organ transplantation were going to be possible, particularly for vital organs such as the heart, where you only have one, a source of fresh, viable organs would be necessary. You cannot get fresh, viable organs from a corpse. The second thing to note is that brain death is a multi-billion-dollar industry. And whenever money is involved, our moral lens tends to become distorted. Now, I am asked, who makes that money? Well, the short answer is everyone makes that money except for the donor. It's illegal in the United States for an organ donor to profit from his or her organs. In direct contrast, for organ procurement organizations, they profit in direct proportion to the number of organs they harvest. So they have a compelling financial interest to convince families that they should donate their loved ones' organs. I would say that this is a conflict of interest. They use manipulative language, like, you can make your loved one's death meaningful. Now, the Harvard criteria in 1968 for a determination of brain death were centered around a bedside clinical examination, which needed to show three things: absence of brainstem reflexes, a state of coma, so complete unresponsiveness to even the most painful stimuli, and failure of something called the apnea test, which means when the carbon dioxide level in your blood is allowed to increase, if the patient does not begin to spontaneously breathe, that is considered compatible with a diagnosis of brain death. They also said that the EEG, or electroencephalogram, was of great confirmatory value. In 1981, the President's Commission approved the Uniform Determination of Death Act. That serves as a model for laws which are then passed by individual states. And at this time, all 50 states, including Texas, have passed some version of the Uniform Determination of Death Act, albeit with slight variations in the language. This is what it states, and you can see that up on your screen, but I'll read it for all of us. An individual who has sustained either one, irreversible cessation of circulatory and respiratory functions, or two, irreversible cessation of all functions of the entire brain, including the brainstem, is dead. A determination of death must be made in accordance with accepted medical standards. So legally, a person can be declared dead in one of two ways. The traditional way, where the heart stops, the lung stops, and all vital function ceases, or this new way called brain death. And the accepted medical standard at the time were the Harvard guidelines. Now, in 1995, the American Academy of Neurology published guidelines for determining brain death, which were last updated in 2010, and today effectively serve as the accepted medical standard in the United States. For purposes of our discussion today, they're very similar to the Harvard guidelines, and they're centered around a bedside clinical examination. I'd like to go over with you some of the problems with those guidelines. First of all, a diagnosis of brain death equates unresponsiveness with unconsciousness. Now think back to Zach's story for a moment. Zach was unresponsive, but he was conscious. He could hear what the doctor was saying, but he was powerless to do anything about it. There is no way that modern medicine can determine whether someone who is unresponsive is inwardly conscious or not. So the same thing that happened to Zach could happen to you or your loved ones if you're an organ donor. Imagine how scary it would be if you could hear someone declare you brain dead. You're going to have your organs harvested, and there was nothing you could do about it. The second thing is that a bedside clinical examination is incapable of determining the irreversible loss of all brain function. And moreover, the ancillary studies that are allowed by the American Academy of Neurology guidelines, the EEG and cerebral perfusion studies, are incapable of determining the irreversible loss of all brain function. They can't do it. So what that means is that the American Academy of Neurology guidelines cannot guarantee what the law of the land, the Uniform Determination of Death Act, stipulates as necessary for a declaration of brain death. With these guidelines, a living person can certainly be misdiagnosed as dead. The third thing is that spontaneous movements in various stretch reflexes, so the patient is moving his or her arms and legs, are considered compatible with a diagnosis of brain death. Now, at this point, you're all probably very concerned, right? The patient is moving, but we're being told they're dead. I'm going to show you a video, okay? In this video, there is a neurosurgeon. This neurosurgeon is clinically examining a young man who has been declared brain dead. You will see him take his head, flex his neck, and the man will bring his arms forward like this in something called the Lazarus sign. And what this neurosurgeon will say to you is, don't worry, he's actually dead. Don't let this dissuade you. We're going to watch the video and you can decide for yourself.
Agora flete a cabeça dele. Fletinho. Fletinho. Isso, que é na medula. Mostrando que é na medula.
So he's not speaking English, but that is, he's actually teaching the residents and fellows to not be concerned about this. That young man, we're being told, is dead. they will harvest his organs. Now, movements like this are dismissed by brain death proponents as originating from the spinal cord, okay? Which really doesn't make any sense because the brain and spinal cord are both parts of the central nervous system. There are continuous neural tracts running between the two. And what we're being told is that once these tracts cross the skull base, they magically lose moral significance. All right? And moreover, movements like this one is very likely are mediated by the brainstem and not the spinal cord. And I'm going to note here at this place that when patients have their organs harvested who are brain dead, they're given anesthesia and paralytics. But if they were truly dead, why would they need anesthesia? If they were truly dead, they wouldn't be moving. Why do we need to give them paralytics? Now, the fourth thing is the American Academy of Neurology considers persistent function of a part of the brain called the hypothalamus compatible with a diagnosis of brain death. Now, this is an obvious contradiction. Part of the brain is still functioning, but we're declaring the patient brain dead. But that's how this is rolled. We make the rules up as we go to continue to justify brain death. Now, you may ask yourself, how many patients declared brain dead still have persistent function of the hypothalamus? And the answer is at least half of them, and likely many more, but at least half. Now, brain death proponents repeat mantra-like that a diagnosis of brain death is a reliable diagnosis. And what they mean by that is, if a patient is diagnosed as brain dead, then the brain is certainly dead, because this is death we're talking about. We don't want to mess this up, right? Now remember, the Uniform Determination of Death Act stipulates the irreversible loss of all brain function for a patient to be declared as dead. Therefore, according to the law of the land, at least half of patients declared brain dead, according to the American Academy of Neurology guidelines, are still alive when their organs are harvested because the hypothalamus is still functioning. So if we as a society were going to be intellectually honest, when a patient comes to get their when a person comes to get their driver's license and they're signing up whether to become an organ donor or not, if we were to give them truly informed consent, we would have to say, you have a 50-50 shot of being dead or alive when your organs are harvested. Now, how many people do you think are going to sign up to be organ donors if we tell them that? And this is assuming that the Uniform Determination of Death Act is a valid criterion, which it's not. All of these patients are still alive. All of them. I'd like to tell you another story about a patient declared brain dead. In 2013, at the age of 13, Jahi McMath underwent a complex oropharyngeal surgery in her throat to address her obstructive sleep apnea. After the surgery, complications developed, excessive bleeding from the surgical site, and at one point, her heart stopped for 10 minutes. 2 days later, she was declared brain dead. Now, it's very important to note that the guidelines for a diagnosis of brain death were very, very closely followed in this particular case. Very closely followed. New, extensive documentation, all right? Nonetheless, Jahi continued to survive for another 4.5 years before succumbing to abdominal complications. Most of that time, she was in her mother's apartment, on a ventilator, receiving tube feedings. Videos show Jahi moving and responding appropriately to simple commands. Jahi underwent pubertal changes, including menstruation. Now, Jahi was declared brain dead using the current guidelines, but she was neither dead nor was she brain dead. And so the question arises, how many patients like Zach and Jahi are there who we never learn about? Because once they're declared brain dead, their organs are harvested or life support is discontinued. The only reason Zach and Jahi survived is because their families didn't accept a diagnosis of brain death and refused to allow their organs to be harvested. So let's watch this video of Jahi and her mother.
Go ahead, move your right hand. And do it hard where people can see it. Very good, Jahi. Okay, can you move your left hand? Move your left hand, boo-boo, where people can see it. I'm waiting. Very good. Can you move it harder? Yes. All right, girlie. And now they can't say that you can't hear your mother.
It's actually a very sad video in a sense because this girl was declared brain dead and they wanted to harvest her organs. And I don't know about you all, but I can imagine my daughter being in that position and how I would feel. I'd like to use her case as a jumping off point to talk about something called chronically brain dead patients. Chronically brain dead patients survive weeks, months, years after a diagnosis of brain death. Now, the rationale behind the Uniform Determination of Death Act, when it came out in 1981, was that the brain is the master integrator of the body. To the brain was attributed the role of the soul. It was thought that once the brain died, cardiovascular collapse would ensue shortly thereafter, within days. But by the late 1990s, over 170 cases had been collected of chronically brain dead patients, proving this false. Rather than undergoing cardiovascular collapse, these patients survived for weeks, months, and years, and they demonstrated persistent bodily integration. They maintained electrolyte balance, pH, and temperature. They fought infection, healed wounds. Brain-dead children demonstrated proportionate physical growth and rarely sexual maturation. Brain-dead pregnant women gestated their children. In other words, brain-dead patients demonstrated persistent bodily integration, indicating persistent presence of the principle of integration, indicating the persistent presence of the soul, indicating that they're still alive. Now, cases of chronically brain-dead patients are the exception and not the rule, but that's because a diagnosis of brain death is a self-fulfilling prophecy, right? Once a patient is diagnosed as brain dead, either life support is discontinued or their organs are harvested. And we don't know whether they would have survived or not. My hope is, at this point, all of you can see very clearly in your minds the difference between a corpse and a brain-dead patient. The corpse is cold, gray, and lifeless. Think of that picture from the morgue of what death looks like. A brain-dead patient is warm and pink. They have supple flesh. They have a heartbeat. They're capable of movement. Think of that young man being examined by the neurosurgeon. To claim that brain death is the same thing as death requires you to disbelieve your own eyes. It's like the emperor with no clothes. Everyone's saying he has beautiful clothes, and only the child is the one with the courage to say he's stark naked, right? Brain death is the same thing. You don't need to be a medical doctor to know that young man was alive. So what are my take-home points for you? The goal of organ transplantation is to save lives. But we cannot save lives at the expense of other people, even sick or dying people. And this is very important to remember. A human person can never lose their dignity. They can only be treated in an undignified way. We did not give ourselves our dignity. God gave us our dignity by making us in his image and likeness. Each of us was ransomed by the precious blood of the Lamb, and we are not expendable. The evidence at the medical, the metaphysical, and the biophilosophical levels all confirms what the layperson intuitively knows, and that is that the brain-dead patient is not dead. The physicians, scholars, and lawyers who created and continue to promote brain death have kept the truth hidden from the general public because they know if you were to see with your own eyes, which you have seen today, you would know the brain-dead patient is not dead. But now is the time for the public to know the truth. Now is the time for people to have truly informed consent. This is a wallet card from a group called HALO, Healthcare Advocacy and Leadership Organization. What you do is you sign this card and you wrap it around your driver's license, and that way you or your loved ones will not have your organs harvested if you're in a motor vehicle accident. I would highly recommend that you get those for yourself and your loved ones because you don't want happening to you what happened to Zach. Together, we can bring attention to this issue. Together, we can do this. It's going to take a great deal of courage. I will tell you that right now. It's going to take a great deal of work. But as Bishop Strickland said this morning at the prayer breakfast, we must take it to the streets, all right? The light needs to shine in the darkness, and we can do it together, all right? But it'll take all of us. If you believe this was a valuable presentation, share this information with other people, please, all right? There's not enough people talking about this. This may be the first time you've heard about this, even though you've been in the pro-life movement for a very long time. So let's work together, all right? Let's do this. And we can get laws passed for informed consent and conscious protection rights so that people know what's actually going on. I really and truly thank you for your time, and I thank you for your attention.
Let's hear it for Dr. Eble. And one question, Doctor, it seems to be on everybody's mind because we got multiple people asking the same question, is if they have signed up to be organ donors, how do they get off of that list?
Yeah, it's a good question. I honestly don't know. I think it's probably going to depend by state, but it's much harder to get off than to get on, which is why I think these cards are very important, is because you'll have two witnesses sign along with you to make sure that it doesn't happen to you. And also if you have a healthcare provider, healthcare power of attorney or something like that, talk to them as well. But I think depending on where you live, I'm not from Texas, so I don't know exactly what you'd have to do to get off that, unfortunately. But you should try. You certainly should try.
And one other question. Are there any known cases where healthcare providers' pro-brain death diagnosis survived being declared brain dead or declared brain death? Are there known cases where where healthcare providers' pro-brain death diagnosis survived being declared brain dead?
So if I understand the question, have there been patients who have survived after being declared brain dead? Is that correct?
It looks like what they're saying.
I mean, the answer is absolutely yes. I mean, lots of cases. There's actually a case in Britain right now of a young man who was declared brain dead about 10 months ago now. And he is regaining various functions. He has a GoFundMe page. But the thing that really, to me, is frightening is we don't know how many of these patients could have come back. And without getting into the medical weeds too much, there is a condition called global ischemic penumbra. So, when you have a severe brain injury, okay, your brain may shut down, sort of go into a safety mode, like any other injured thing in your body, where it's not dead, but it's not really functioning like it should be either, so as to protect itself, okay? In the brain, this is called global ischemic penumbra, which means the brain is still viable and alive, but it's not functioning, okay? This is an exact mimic of brain death clinically and using the ancillary studies of the American Academy of Neurology. It's an exact mimic, okay? So when a patient is in a severe brain injury, those organs are typically harvested very quickly in the first 2 or 3 days, which is precisely the window of global ischemic penumbra, without time allowed for recovery of the patient. So to answer the question, yes, certainly patients have been declared brain dead who are not brain dead. How many? We do not know. But to be very clear, even if a patient really and truly were brain dead, because there is a case out there of a young man named TK who really and truly was brain dead. He had suffered from a Haemophilus influenza meningitis of his brain, which had destroyed it at the age of 4.5. But he continued to survive for another 20 years. When he finally died, they sawed open his skull, and inside was this calcified spherical mass. And when they sawed through that, inside they found grumous material and cystic spaces, which basically means debris, with no recognizable neuronal elements, even under the microscope. Nothing. He had no cerebrum, no cerebellum, no brainstem, no circle of Willis, nothing. He had nothing. But he was still alive. His body was demonstrating persistent bodily integration. And for Bishop Strickland, who has interest in philosophy, there was the Cartesian body-mind duality has permeated our culture so deeply. And whether you say that's body-mind or body-brain, to the brain has been attributed essentially the role of the soul. And that's really what this is based on, and that's not accurate. And medical reality has shown us that's not accurate, which is why in medical ethics, you always have to follow the evidence. You have to begin with what God has given us And then you take philosophy and you go back and try to explain reality. But you can't start with philosophy and try to retrograde and make it fit on the reality that's there and explain it away.
Well, I'm truly fascinated by all this, and I can tell you are too, because I keep getting more and more questions. So if you don't mind,
I've been answering questions for hours in some of these, so I'm sure they'll keep coming like forever.
All right, we'll have to push pause at some point. But what test is used to determine that one has no brain function, and how effective is it?
So that bedside clinical examination. So the bedside clinical examination is what's used to diagnose brain death. The ancillary studies, the EEG and the cerebral perfusion studies, are not considered necessary by the American Academy of Neurology guidelines. They are also insufficient to diagnose. They're incapable of determining that the brain has irreversibly lost function. So you have two questions. One, if a patient truly has had complete and irreversible destruction of the brain, are they dead? The answer is no, not necessarily. I mean, oftentimes these patients have had polytrauma, and so there's a lot of things going on. The second question is, can we diagnose if there has been complete and irreversible destruction of the brain? And the answer is also no. So it's a two-pronged no. And so the answer is the brain dead patients are always alive. And you may have seen in the news, and if you have not, I have a brief article in the National Catholic Register that mentions this. They have taken, searching for organs, they now have taken pig kidneys and genetically modified the pigs such that the organ will not be rejected by the body. Okay? Now, the question is, how can you test that, right? Because it would seem medically unethical to test that on a human person. Well, interestingly enough, brain dead patients are biologically alive but legally dead. So brain dead patients are who they have tested these on, which is quite morbid. But when they hook the kidney, the pig kidney, up to the brain dead patient, it functions. Well, why does it function? Well, it functions because the patient is still alive. If you were to hook a pig kidney up to a corpse, guess what? Nothing would happen. All right? And so we have an intellectual dishonesty going on right now in our country. It's a separate question whether we can still harvest the organs of brain dead patients despite the fact they're alive. Okay, that's a moral question. That's an ethical question. I'm saying purely from a scientific point of view, we're being intellectually dishonest because they're clearly alive and we're pretending like they're dead.
So what is the solution for organ transplants for people that need that kind of treatment?
Living organ donors is one, okay? So kidneys is the most popular form of living organ transplants. Kidney, liver are the most common that come from living donors. I don't want to go out on a limb, but it seems to me that taking organs from a pig is ethically legitimate. I don't see a glaring problem with that. Now, I would be open to someone arguing against it, but from just looking at it sort of first blush as this has come onto the field, I don't see that is ethically illegitimate. Now, with respect to the heart, there are artificial hearts. So there are mechanical hearts. My alma mater, Duke, just transferred what they called a next generation artificial heart into a 39-year-old man last summer. So I'm assuming they think it's going to last a while because the guy was only 39 years old. But I truly believe medicine will find a way to provide organs if we take the morally illegitimate option off the table, right? And so medicine's not going to do that as long as there's free organs coming from donors that don't make any money, right? Those are free. Remember, the donor cannot profit from his or her organs. So we have to get that off the field, and then we can focus on how, well, medicine will do it for us because there's going to be money in it, but medical innovation in terms of how we can provide these other organs.
And finally, what can doctors and nurses do to support this cause?
Talk about it. If you know another venue in which you want me to speak, bring me to speak about it, because there are not enough speakers on this topic. All right? Most physicians will not speak about it because you'll get fired. I don't work for a hospital. I work for my own S-Corp. Okay? I'm not at risk of being fired. But you can imagine if a physician starts speaking out in his or her own hospital, a reason may be found for that person to disappear. And I'm serious, unfortunately, because it's a multi-billion-dollar industry. That's just the reality. And so I would say talk about it, bring it up to your bishop, bring it up to your priest, to your pastor, bring it up to your state legislators. It's going to take all of us working together, especially young people. Young people, this is going to be our mark on the pro-life movement, all right? I mean, you're looking at me and you're thinking, that guy's not that old. Well, if I know, I don't know why I'm like, I don't know. I mean, I would feel like there should be like mentors for me, like out there, like, you know, like doing this in the grassroots level, but no. So you guys, I mean, it's up to the young people, man. I mean, like, it's up to us because you're not afraid of blowback. Young people have courage. Young people have courage, and they will push for it, whether it's convenient or inconvenient. So, especially you young people, start talking about this on your campus and bring it up to pro-life Students for Life. If you guys are involved with that or something, bring it up to that group. I mean, it's going to take all of us. It is going to be a huge push, but we can do it, and we'll do it. We'll do it together.
I believe it. Thank you, Dr. Eble.
Thank you.